Hello everyone. Today, we're exploring the medication known as darolutamide, commonly referred to by its brand name, Nubeqa. This discussion is intended for educational purposes. For health-related questions or concerns, consulting with a medical professional is always the best course of action. Description: Darolutamide, branded as Nubeqa, is an oral tablet classified under the category of nonsteroidal antiandrogens. Its main mechanism involves blocking the effects of androgens, male hormones, such as testosterone, which can encourage the growth of prostate cancer cells. Approved by the FDA in 2019, darolutamide is primarily used in the treatment of non-metastatic castration-resistant prostate cancer, NMCRPC, a condition where prostate cancer continues to grow despite the testicular testosterone being reduced to very low levels by medical or surgical castration. The goal of darolutamide in treating NMCRPC is to delay the spread of cancer and prolong the time without the disease worsening. It's usually prescribed alongside a gonadotropin-releasing hormone, GnRH, analog or in patients who have had a bilateral orchiectomy, surgical castration. Warnings: before starting darolutamide, it's crucial to understand the precautions associated with its use. Patients with severe hepatic impairment should use darolutamide with caution due to the potential increase in exposure, which might necessitate dose adjustments. Additionally, it's important to monitor for any signs of respiratory tract infections during treatment, as darolutamide can increase the risk of such conditions. Before taking this medicine, it's essential to discuss with your healthcare provider if you have any allergies to the medication, as well as any history of liver disease, heart disease, or if you're taking any other medications that might interact with darolutamide. Pregnant or breastfeeding women should not handle the medication without protective gloves due to the potential for harm to the fetus or newborn. Also, it's important for men with female partners of reproductive potential to use effective contraception during and for a period after the completion of treatment. Side effects: as with any medication, darolutamide may cause side effects. Common side effects include fatigue, pain in extremities, and rash. While most side effects are manageable, it's important to report any severe or unusual symptoms to your healthcare provider immediately. Serious side effects can include heart problems, such as heart failure, and liver problems, indicated by symptoms like yellowing of the skin or eyes, severe nausea or vomiting, and loss of appetite. Interactions: darolutamide can interact with other medications, potentially altering its effectiveness or increasing the risk of side effects. Inform your healthcare provider about all medications, supplements, and herbal products you are taking. Special attention should be given to drugs metabolized by CYP2C8 and CYP3A4 enzymes, as darolutamide may affect their metabolism. Dosage: the correct dosage of darolutamide is crucial for its effectiveness. The standard dosage for the treatment of NMCRPC is 600 mg, 300 mg tablets, taken orally twice daily, with food. Patients are advised to adhere strictly to the prescribed dosage and schedule, and not to adjust their dose unless directed by their healthcare provider. Avoid: while taking darolutamide, patients should avoid activities that require alertness until they understand how the drug affects them, due to the potential for side effects such as fatigue and dizziness. It's also recommended to avoid the use of grapefruit products, as they can increase serum concentrations of darolutamide, potentially leading to increased side effects. FAQ: a common question about darolutamide relates to its use in women. Darolutamide is specifically indicated for the treatment of NMCRPC in men and is not used in women. Always consult with a healthcare provider for any specific queries related to this medication. Closing: that concludes our overview of darolutamide, or Nubeqa. Remember, this information is provided for educational purposes and should not replace professional medical advice. For any questions or concerns regarding this medication, consult with a healthcare provider. Thank you for joining us.